Now, every day in this country, Nigerians are confronted with the stark reality of their broken healthcare system. No one can deny that Nigeria's health infrastructure is one of the worst in the world, and for decades, no government has paid much attention to it, in spite of the fact that virtually every day there are coruscating warnings from the World Health Organization and from local health officials that after years of neglect, this country is in a healthcare crisis and cannot afford to continue with business as usual. Well, a year ago, the Tinubu administration declared a state of emergency in the health sector. So since then, what have they done to improve healthcare in Nigeria? Well, the government has been holding a health sector review here in Abuja, assessing how far they've come in their promise to deliver quality health care to Nigerians. And the Minister of Health and Social Welfare, Professor Muhammed Ali-Pate, joins me now in the studio. Thank you very much indeed for coming in.
Thank you for having me.
I was just speaking with you earlier and talking about what a long day you've had.
Yes, it has been a long day, but a very productive one as well.
Well, we appreciate your squeezing us in spite of the fact that you've obviously had a fairly long day. And first of all, before we get into your particular area, we heard sort of the sad news of the death of the Chief of Army Staff, Lieutenant General Labaja, who passed away on Tuesday night in Lagos. I wonder what your reaction is to that.
I think our condolence to his family, to his friends, and to all of us Nigerians. He is a leader who served his country well, and is an example for many other leaders who follow. So it's really an unfortunate situation, but I think we also pray for his soul and pray that those who step into his shoes will learn from his example.
Amen. Now, the stark message used to be that if you are struck down by a major illness and you want to live, you're struck down in Nigeria, you better find the money to go abroad for treatment. Is it still as stark as that?
I think the story is more nuanced than that. For a very long time, Nigeria has not invested sufficiently in its health. It has not prioritized. It has produced many doctors, excellent professionals, domestically, but also outside this country. In the last 1.5 years, we've seen a president who prioritized the health sector as a key driver of the transformation and his vision for a prosperous Nigeria, which depends on the health and the human capital of its people. He laid out an agenda and he unveiled it in a way that is collaborative, given the reality of our governance in this country, bringing state governments, local governments, development partners, private sector, and getting us all to respond to our citizens' needs, investing more of domestic resources in the health sector. So the journey started a year ago, and today we have had an opportunity to begin reviewing the performance and to respond to our citizens with the results and the learnings. It's a mixed picture. There are positive news. For instance, child mortality in Nigeria has reduced by 16.7% if you compare DHS 2018 to the one that was conducted end of last year. And that trend has continued. We've seen increase in utilization of services, hypertension, diabetes, some cancers. Not so good news in terms of things like mammography among women, perhaps because of cost. On the not so good news, we've seen the cost of care increased and more Nigerians are hurting because of that. That is a signal and we're working hard to rectify it. Fixing a complex health system like the one that we have requires focus, requires diligence in the execution, but requires accountability mechanisms and also measurement of performance. That's what we've been trying to do under the leadership of the president. And I think we're beginning to get out of the road. I can tell you many more specific things that we have been able to execute on and things that in the next few months will start to be open for Nigerians to see for themselves.
Well, let's start by talking about cost, because that's obviously an important thing. I mean, you mentioned cost. You said that is something you're dealing with. How exactly are you dealing with that?
So the backdrop is that healthcare and good healthcare is not necessarily cheap healthcare. As a country, the proportion, the investment that we've been making in our health sector for years has been subpar compared to other countries at our level of development. we have had an increase, but yet there is a lot more resources that need to be invested.
Right, but how substantial is that increase?
So the federal government, for the first time, passed the threshold of 5% of the federal budget invested in health and channeled part of the resources that it receives from the Federation account through the Basic Healthcare Provision Fund to all the states. Almost 46 billion naira over the last 9 months have been channeled through the states to expand primary healthcare services through more than 8,000 primary healthcare centers for those at the bottom of the pyramid, for women, for children. In addition, for the first time, we've seen an effort to expand the cancer infrastructure and equipment in 6 major centers in this country, approved by the president. And the first 2 will be open, we expect, in May 2025, despite the devaluation, despite the inflation. And of course, there's a lot more that will need to be put in the next year's budget to ensure that we complete. If we do that, this will be the first time that we're taking a decisive move to have a world-class infrastructure to deal with the problem of cancer, which is a major issue in our country.
Absolutely.
Similarly, other diagnostic centers, at least 8 are currently being constructed, and 2 oncology centers. So that's on the infrastructure side, but they cost money. And so while we've seen an increase, the president has committed to continue increasing domestic financing, and the states will also need to match up. So they also prioritize, because it takes federal government, states, and local governments together.
I'm going to come to the states in a minute. But, I mean, how do you raise standards? You yourself talked about devaluation. How do you raise standards in a country where the value of the naira has been falling dramatically and the cost of living is rising? So even if you increase your budget, in real terms, there's no increase at all, is there?
Well, I think this first, use of what we have and use it well. When we prioritize the basic level, and when patients are able to get immunization, malaria, antibiotics at the front line, they don't have to use the higher level services. The allocative efficiency is improved, and the teaching hospital can focus on the more complicated cases. In the absence of a strong primary healthcare system, you end up treating malaria at the teaching hospital, and that's wasteful. Secondly, when you deal with issues of quality, like the standards of care, the training of health workers, that in a way improves the outcomes that you have even when you access care, because poor quality care is wasteful care. So by trying to improve quality as well as access, we can improve outcomes. And we have tried to retrain frontline health workers. 120,000 of them is our aim. And between when we started and now, more than 40,000 have been retrained in the front ends, so that they're equipped with knowledge and the standards to apply when they interact with patients. So there are things that you can do with the existing resources and spend it well. But then we get more from the government, as well as from the private sector, from our development partners. In terms of mobilization of the resources, expanding insurance is another way to improve the affordability. But someone has to pay the premium.
Yeah.
Well, for the poorest, we've expanded the Vulnerable Groups Fund, and more than hundreds of thousands of Nigerians have been included in that. These are initial steps, and I'm by no means saying that these are conclusive, that the problems have been solved, because they are decades in the making. But at least we're beginning on a journey of transformation, which, if sustained over many, many years, beyond the terms of this president or this administration, we as a people have to make a commitment that we prioritize improvement of the health infrastructure and the services, and for all Nigerians, because you cannot leave some and then cater for only a few. Then we will get there. It's not just about one level of government or one president or a few ministers doing that. It is all of us have to build that consensus to say health is important to us, and that we want to invest in it. And we put the resources behind it, and we execute, and we hold ourselves accountable.
Now, I presume you've seen the latest report released by Legatum Prosperity Index, which ranks Nigeria 11th out of 12 countries with the worst healthcare globally. The report said it reflects not only a lack of funding, but also critical gaps in infrastructure and workforce shortages. What's your reaction to that?
I've seen the Legatum Index, and there are many indices in terms of health system performance. What indices do is they simplify very complicated issues into a single number. When you look at the reality of Nigeria, we have 36 state and federal capital territory. There are states that have made giant leaps in terms of improving health outcomes, and their systems are different. Their institutions are stronger, their resources are different, the nature. Take Lagos, one of the lowest incidences of malaria. Others have made tremendous progress in reproductive health, like Imo State, while others are struggling with immunization, if you go to Sokoto State. But when you take an index, you are taking an average, which hides huge disparity within our country. So this year, at the Joint Health Sector Review, we have the State of Health Report, which has a scorecard for each state across 5 domains, how they have fared over the last 5 years, so that the governors have actionable information as to where they are relative to others, and not to pass judgment, but to learn. For instance, Imo has done well in some aspects. What do we learn from it? Ondo has improved in terms of child mortality. What has it done? What do we learn from it? What does Gombe need to teach us about reproductive health? By doing so, then we so the Legatum Index is just one index, and the methodology, the assumption behind the relative value of the numbers has to be looked at before you actually pass a judgment. So it's one of those indices that people are fond of to simplify very complicated issues. But here on the real issue, look at DHS, 46,000 households surveyed in 2018, 46,000 in 2023. Look at the perception of Nigerians. We did a People's Voices survey in 2023, June. I was at Harvard at that time. Before I came back to government, we commissioned that, and the results came, and that informed some of what we've tried to do. Now, a year later, we had a perception survey of 2,600 Nigerians to ask them, are you confident about the Nigerian healthcare system? About half said yes. Are you confident the government is able to deal with emergencies? 54% said
Well, I'd be
yes.
curious to know who that half is, because, I mean, if you do what we call a person on the street straw poll, go around the studio or go out into the hotel here, I mean, the reaction, and that is something that we do as journalists all the time, the reaction is very different from what you're suggesting.
So that's the point, because you see, it's easy to build a narrative on the basis of anecdotes or simple, small pieces of information. What we've tried to do is to use a systematic way of sampling the population that is called upon in this survey. It is not perfect in terms of its power, and it's only 2,600, but at least it's a start, complementing what we also have from the DHS. So at least we're improving in terms of our ability to use facts
I agree
to balance, and the insights we're getting are fairly consistent to, let's say, the shared experiences that we've gathered from folks. The utilization has increased, but costs have also gone up, for instance, and that some areas utilization has gone down, and you can see why. So I would not dismiss those in as much as the single individual story, and there are many stories. I can tell you stories of horror, but I can tell you many more stories of good experiences with the Nigerian healthcare system.
Well, I mean, the interesting thing, and I don't want to kind of dwell on that,
Yes.
but the interesting thing that I get from this, which I think is a little more impressive than what it used to be, is the fact that you're using numbers and figures to support what you say. That's a very important thing, and that suggests a modernization of the process. But the fact also remains that you are doing what we call selective synchronization. I mean, you're choosing to discard the Legatum Index survey and picking your own. I mean, which obviously raises questions about which you intend to sort of
the two are measuring different
prioritize.
things. No, they're measuring very different things. Legatum is looking at an index that looks at across countries. And you need to go down to look at what comprises, what are the components of that index and how are they weighted. On the other hand, what I'm telling you is that a sample of Nigerians had been surveyed, similar to the ones that we had surveyed in 2023. And there are certain emerging trends. And this is just first year. And I'm not presuming that this has solved it all.
No, I understand
or that it's all rosy.
Right.
By no means that. But that we're beginning a journey of transformation that is matched with facts, with measurement, with accountability, and the fact that we are discussing it openly with Nigerians, with state governors, with civil society, private sector, and it's to be tested. And I believe many scholars will study this. And if we keep this track over time, beyond the period that I will serve beyond the 2 terms that we expect this president to serve, I believe that this country will be on a path to having a better health system and being a healthier country. So long as we stop at the point of anecdotes and what I call faith-based policies and programming, we will struggle because we will be inefficient in where we allocate our resources, our time, and will be muddled up.
And of course, ramping up the quality of healthcare in Nigeria, you touched on this earlier, also depends on the states and the local governments, doesn't it? I mean, who has the leverage to make the states to really ramp up their efforts in the healthcare sector so that it conforms with the plans and policies that you are coming up with at the federal level?
You see, democracy is good. We have a fiscally decentralized system in a very complex country that is very diverse. We're very different in different parts of the country. And the president, in as much as he wants to change this country, he cannot do it alone. The governors are important and they are partners. They are respected partners. The local governments are important and they are respected partners. When we call them up and discuss a compact that governs the relationship between different levels of government, we set expectations. What we would provide as federal government, what we expect from the states. We set the matrices. So it's deployment of soft power. The persuasion that, look, we have an interest, whether you are the federal government, whether you are a state governor, whether you are a local governor, whether you are a civil society, in the issues of health, there's a convergence because no one would want to live in an unhealthy country. So that is a deployment of soft power that this president is pushing. Backed with resources, federal resources that we channel, at least $80, $90 million a year in vaccination that is going to everyone, additional other interventions, as well as our external partners. They announced $3 billion in grant financing over the 3 years to back up this president's plan. And some of those resources are at hand. And those will incentivize states to act. It's not using the stick because there's no stick. In our system, you can only persuade, incentivize, lobby, and the engagement of citizens is so vital. Because if citizens also begin to get the information that, look, this is important to us, then we can have a constructive discussion. And they can ask us, ask leaders, how far are we going? There's no perfection, but at least if you do good, what have we learned from it? If it's not going well, what do we learn from it and how do we course correct?
And is that part of what you're doing at this health sector review?
Precisely. That is one of the elements of the compact. We signed the compact that said on an annual basis, collectively we will sit and look at the facts. We'll take what we learn from each of those sets of facts that we gather. We'll discuss it with Nigerians and we will take decisions at the National Council on Health for the next year when we come back to assemble another set of facts. That was part of the compact that we signed. So we're fulfilling that, and we are also fulfilling a requirement to have the first State of Health report, where we would compile, after these reviews, the State of Nigeria's Health report that has been discussed, reviewed, peer-reviewed, assemble them and present to His Excellency Mr. President, as well as the National Assembly, and to Nigeria. So let it feed the public dialogue, because health affects everybody.
What about the nettlesome issue of brain drain? I mean, lots of doctors and nurses leaving this country have already left. Those still around complaining bitterly about pay and conditions of services and periodically going on strike.
Well, let me say that Nigeria is blessed with having a cohort of health workers across professions, disciplines in the health professions, who are very good and who are committed. Some of whom are working under difficult circumstances across this country. Not everyone is leaving. Admittedly, there are some that are leaving for various reasons, some for family reasons, choice, they want to advance themselves. And you cannot prevent anyone from leaving. In this day and age, anyone can go anywhere else. There is labor, it's a right the individuals have. What we're trying to do is to expand the production of the health workforce. We've doubled the quotas for medical students, nurses, midwives, and now with my colleague in education, we'll try to improve the standards so that we produce more. If some leave, some will stay, and this is backed by evidence in other countries. If you train 10, 3 may leave, 7 will stay. Secondly, Do we make the environment that they work better? And we had a whole health workforce migration policy, being intentional on the incentives, on how we build their capacities, how we enable them to work, the infrastructural improvements, the training opportunities, use data to guide the decision that we make, and how we govern this asset that we have. And finally, in terms of the relationship among the professions, I think the President has signaled really the need for cooperation, mutual respect, building trust among ourselves. We in government are trying to earn the trust of the unions, the associations. They are also trying to earn our trust, and putting the Nigerian person at the center of it. The issue of strike becomes by the way, because health workers are inherently biased towards serving others. And when you
but they also want to be paid.
Yes, but when you go to strikes, essentially the Nigerian person suffers. It's a pregnant woman who dies, an accident victim who doesn't get taken care of. There are issues, and we cannot say there are no issues. Some of them are long-standing issues, 10 years or even more. And believe you me, in the last 14 months, we have begun to address some of those long-standing issues. And I believe that the various associations understood that and appreciated what this president has tried to do. And we will continue. We will not take them for granted. I know the consultants will have certain issues that bother them, which may be the education sector. We're trying our best. Johesu, for instance, which is the Joint Health Sector Union, raised several issues, and we listen to them. We engage, and we're doing our best to meet them.
Right. Before we let you go, Minister, and we appreciate the time you've spent here, I mean, you've held several impressive positions internationally. You were the Global Director for Health, Nutrition and Population at the World Bank Group, and you were also a professor of the practice of public health leadership at Harvard University. I mean, that must be a world away from the realities on the ground here in Nigeria.
Well, this is my home. This is where I belong, and I'm so honored that His Excellency the President asked me to come and serve my country. And it is us and many people who have had similar experiences that have now come to join this team. We have an incredible team in the health sector. The Primary Healthcare Agency, NHIA, the Presidential Initiative Value Chain, NAFDAC, many other institutions, sector-wide program, really amazing professionals that the President has been able to assemble. And that convergence, complemented by existing dedicated civil servants, even in our ministries, the commissioners, brilliant political leaders at the sub-national level. So there's a moment here where there's a convergence of leadership, and it is for us to exercise it. And we've got a vision that the President has set. So with that, I think we are confident that if we continue in this path, and if we focus not on ourselves as individuals, but as on the institutions that we are reforming, we are building, and that these institutions are set to endure, that at least in this area that we have been given the opportunity to serve, we will make some difference and others will build. And finally, even what we have done today, we did take time to appreciate many of the forerunners who have played roles in health sector and did their part. Olukwera Kuti, Professor Oshetimehin of blessed memory, Eitai Lambo, Isaac Adewale, Professor Grange, Professor Yonibu Chichuku, Dr. Ohenire, many of them, and many leaders. So they've built, and each one of them has placed his mark. We are building on the back of that so that we pass on, because institutions transcend all of us. So we're trying to focus our institutions, at least in this arena, so that they respond to the needs of Nigerians. It's not easy, and we're not perfect, but we will try to learn and adapt as we go.
On that note, I want to thank you very much indeed. Professor Muhammed Ali-Pate is the Minister of Health and Social Welfare here in Nigeria. Thank you very much.